committee request from members of the council to assist and to join the QA/QI committee, a combined committee between the REMAC and the REMSCO that has been sent off to Dr. Zazzo for approval. And once again, they are currently working with that committee to work on some quality issues throughout system-wide. St. Francis Hospital had contacted us regarding the e-bridge system and some of the uses and stuff with that. They just had some questions, and that was taken care of by our EMS coordinator, who contacted them and once again went through the system to verify their request for information with them. We did send a letter out once again to the Nassau County Administration in support of the Nassau County Fire Commission. A letter has been sent by the Fire Commission to request the status on the county committee's report recommendations for the sustainability of EMS here in the county, which was started a little over 2 years ago. And at this point, we have sent a letter of support from the council to once again try to get that draft put back on the table, and for the county committee to meet and to discuss the recommendations and once again the response from the administration on that. Other than that, most of the emails have been addressed, and once again any documentation that needed to was sent out via mail. Under my report, once again, I want to thank all the agencies for submitting their required annual paperwork, the EMS surveys, as well as the medical directors forms on time. It was the second year that we had full compliance by January 31st. And once again, we've taken that information and put it out in the coordinator's report. We've documented some of the responses, especially with the EMS coordinator, the EMS survey paperwork that was sent in to make some analysis of the system, where we stand and where we need to go, especially on performance standards and the pending quality metrics that will be forthcoming from the state. The 2023, 2024 REMSCO and Bureau of EMS awards, the forms are out there. They've been online. They're on the state website. We're requesting that all agencies that are going to submit for the awards have them submitted by April 15th, 2024, so that the committee can once again review them and they can be sent up to New York State by the deadline of July 1st, 2024. Once again, any submissions and stuff that agencies have, there's many different categories, both for EMS as well as for emergency departments and other providers that we have out there. Once again, please get them to us. The more that we have, once again, the better we can make the program with that. Later on, I'll discuss once again funding for that, and also to look at a date to host a ceremony for the Bureau of EMS Awards. We have gotten some awards that have been forwarded to us through the Fire Commission for EMS through theirs, and they have given them to us for review as well. And we're looking into at some point possibly doing a first responder type ceremony for regional type awards that we may be giving out. All right. New York State budget for 24-25. There's many different proposals in there. Once again, a lot of regulations that are built into the budget, and I'll leave that up to our EMS coordinator state rep to just maybe highlight some of that, but there's many different things that may impact all agencies throughout our region. Should the budget be passed, we've once again, there's been a lot of money thrown at EMS, and once again, a lot of recognition for the work that we've done coming out of COVID the past 2 to 3 years. And once again, they're looking to elevate the profession, once again, making sure that we take care of the citizens of our region appropriately with them. So more to come on that. Again, the New York State EMS MOLS form has been renewed. There's an expanded form that's out there. I encourage all agencies to do some training on it, to bring it to their membership, to be aware of the provisions that are in the new MOLS form. It's more expansive than the previous form that's out there. There is some training on the Vital Signs Academy through New York State that you can become familiar with it. There is actually a CME attached to it that you can utilize to be able to get that information. It's about an hour, but highly worth it. I've gone through it, and once again, it's very informative, put together by a very highly skilled tag team from New York State of providers, doctors, nurses, as well as medics from around the state and educational people as well. The New York State EPCR platform, NEMSIS 3.5, will replace 3.4 as of July 1st, 2024. Please verify with your EPCR vendors that you will be able to implement it by that date. There may be a grace period for a month or two, but July 1st will be the start date. And beyond that, the agencies will be responsible for making sure that those are complied with and that their agency forms are being submitted appropriately to the state to be reported. The image trend will lead all agencies, as I said, managers, coordinators should have access to the New York State image trend to lead platform to review for effective quality assurance, quality improvement for their agency, and also to determine that those EPCRs have been loaded effectively to the NEMSIS system. It's on each and every agency. That's their requirement to make sure that they are appropriately being documented, as well as, once again, reaching the NEMSIS platform and the hospitals at which they're dropping these patients off with that. We continue with ALS credentialing. Once again, if the ALS providers, the ALS managers would continue to check their rosters and make sure that they haven't still have the same number of ALS providers within their agency. If they do lose some, please email it to the council so that we can remove them from the list. We continue to send out emails to those that failed to credential. And once again, we do pay for each credentialed provider that is on the credentialing list. So once again, it is a financial issue as well for the program agency, as well as REMSCO and REMAC. The next New York State REMSCO CMAC meetings will be held on May 7th and 8th. They're live streamed. Once again, all providers should be available to, once again, watch the live stream. A lot of important information coming up with that. The New York State EMS Memorial will be held on Wednesday, May 22nd in Albany. Those that, once again, will be attending. The Nassau County EMS Memorial, as I said, I'm working with an architect. We've had some brief conversations informally at this point. I've also brought it to the Fire Commission's attention that possibly we could have a combined fire and EMS memorial over in Eisenhower Park and look at the funding and stuff that would be necessary. I believe they have to replace the one that they currently have. So more to come on that. I have some committee members that have expressed interest in working with that. And once again, working to get a draft and a design for that memorial to once again be brought back to the committee and the council to see if we can get the funding necessary in order to make that happen. So that is something that continue to work on. Like I said, we'll update you at the May meeting and stuff regarding that. We're looking to have another virtual REMSCO meeting sometime in March to update all of our providers and all of our leadership on some of the things that are going on here in the region, both on the state level as well as the regional, and also once again to update them on the planning and the training necessary for the new MCI policy that's being completed. The e-bridge communication system is continuing to improve. We're working on some improvements to that, some added tiles as become more comfortable with the use of it. The hospitals have asked us to once again make sure that we're including the appropriate information on there, especially for strokes, STEMIs, and traumas, so that they can activate the system for their entire teams. So I said, going through eBridge allows them to be able to forward it through the hospital to the various teams without having to go overhead, and making sure that everybody is notified in a timely fashion to respond to these emergencies. So our request is that they have put the money forth to support this system. I think we need to, once again, make sure we get the appropriate information there so that they can meet the needs of the patients that we bring them. As you know, the EMT CC program is scheduled at this point to sunset as of July 1st, 2027. Currently, they're working out the schedule. There's a class currently scheduling and stuff for April, and the last scheduled class currently is for April of 2026. That may change based upon, once again, the state requirements and their recommendations with that. But the CMAC, as well as the Med Standards and the REMSCO, have adopted that date as the sunset date. All CCs beyond that point that do not bridge from CC to paramedic, effective that date will drop to the AEMT level within the system. All right. Legal and Government Affairs, I've reached out with one of the changes and stuff. I've reached out to Legal and Governmental. We are due to review the bylaws for the council this year. Every 2 years, on the even years, we need to review them and look at that. I've asked Council Member Francis DeBovis to convene a meeting of the committee and review all of the bylaws to be brought up at the September 2024 meeting for adoption for the next 2 years, and to make any recommended changes to that. And the last thing is just, I would ask once again to consider, we generally have our June meeting of the REMSCO, or our July meeting in June, to free up July for vacations. It's generally the second week of June, which would fall on Wednesday, June 12th. I would ask that we consider possibly moving that back a week, only because, as you know, there is a worldwide cricket tournament that's coming to Nassau County from June 3rd to June 12th. June 12th will be the final day. Many of our agencies and many of our providers and stuff may be involved in this. We're still waiting to find out how REMSCO is going to take part and how we can coordinate the response and stuff as necessary for this particular event. So I would ask that we possibly move that back, or if somebody has another date in mind. So I would say the 19th would be probably the best day to do that, to not push it back into July for that. Other than that, that's all I have. Is there any other questions for me regarding anything that's been brought up? Okay. Vice Chairman's report, Dave Calvo.
No report, Chairman.
Secretary Treasurer's report, Tom Devaney.
All right, you get the business savings, $24,439.08. The checking account, $16,170.04. The marketing account, $69,148.09. We had a deposit of $100 from departments that went switched over the title for the district, and we had two expenses. One was the eBridge 2-year renewal for $5,200, and the other one was for paying the AOS provider directory, and the website was $2,661.
We'll move on to the state EMS representative and coordinator's report, Don Hudson.
Good afternoon, everybody. So the reports the EMS coordinator's report goes out every Friday, not directly to each provider due to it being difficult to manage who actually wants it and who doesn't, on top of failed email kickbacks that usually number in the hundreds. So rather than fill up out boxes and inboxes with nonsense, those are posted for everybody to see on nassems.org. If indeed you're not getting them as intended by your EMS manager for your agency. As you know, REMSCO and REMAC members, along with all the EMS managers and through the Fire Commission BAT FD system, agency leadership gets them. So it should be out there. Most of the state stuff is encompassed in there. Those of you in attendance right now probably noticed that the packet before you is thicker than normal. If you flip past the first 3 pages, which is the REMSCO agenda that we find ourselves at, this is all of the information for the proposed executive budget changes related to EMS, some parallel and mostly complementary assembly and legislative changes that are proposed, Assembly and Senate. The New York State Association of Counties has weighed in on this, so there's backing for that. You see that ties to the Senate and the Assembly. If you haven't already attended one of the 15 or so presentations around the state, both virtual and in person, being done by the Bureau of EMS, the next 2 pages relates to what's already in law and is currently being built out from last year's budget, which is State EMS Task Force and some assets and things related to that. Lastly, nope, I spoke too soon. Next, systems performance standards. So within the EMS agenda for the future, the state EMS white paper that came from the REMSCO and all of its subcommittees, a number of recommendations, not the least of which is setting EMS performance standards. So again, this is complementary and somewhat parallel to some of the regulatory and statutory changes that are in discussion, but these were voted on at the last REMSCO for implementation statewide. The ask from the chairman was each committee to submit 2 recommendations to the REMSCO, and the REMSCO would pick 2 to begin with, more of them to follow. So the first is related to response criterion and what that would look like. So please review that and let's talk. Including definitions and thresholds for mutual aids and distances traveled, call volume, how many calls are you going to, how many are you not going to, and what the reporting would look like for that. The next set is quality metrics. So this goes to our medical directors, CMAC and REMAC, for the data that we're all desperately looking for to see where we are versus where we need to be and want to be from a patient care perspective. So that's there. Before I speak too soon, yes, lastly, this is a crosswalk from Onion, which is the United New York Ambulance Network, basically the, for lack of a better term, benevolent organization that represents the commercial ambulance industry that put through a crosswalk between the previously aforementioned state and Senate bills and some of the budget stuff. So lastly, I'll close with news to me, and Chuck constantly jokes that we have to have civics classes in order to understand the world that we live in. So in New York State, there's 2 ways to change laws. The first is what we probably all remember from Saturday morning cartoons, and a bill is a bill, and conjunction, junction, what's your function? Where that goes through the legislative process, meaning the state assembly and or the state Senate, where representatives propose bills, they go to committee, they come out of committee, they pass one house, they pass the other house, and then the governor signs them into law. There's another process that was somewhat new to many of us called the budget. So embedded in every state budget for seemingly as far back as ever, the governor proposes and then signs into law these changes. So what we're talking about are modifications to Article 30, modifications to or additions to Article 30. So as you look through that first thing you come to, our New York, our future, the executive budget summary, This is specific and highlighted the EMS portions of that proposed governor's legislation. Now, this is out already for 30-day comments. Those comments have come back. That means that there's then 30-day additions or revisions that are proposed. But in the absence of massive changes, it's assumed that this may or probably go through as is. Now, I say may or probably because, as we remember from Part S and Part F in two previous budgets, some things went through, the EMS task force, other things did not, like essential services. So essential services you'll see as principal in here on top of some very revolutionary term first in the nation have been proposed. So you really should be looking at this and we should all be discussing this. Just to wet your whistle, I'll leave you with the prospect of paramedic urgent cares and paramedics opening up essentially practices in EMS agencies utilizing telemedicine for office visits. Right. The caveat to that is right now that is restrained to the half the state or so that is defined as a rural county. But let's not fool ourselves. If that goes through and shows promise, why would the other counties not want a piece of that? So I think it's time. What I'm suggesting is to have that conversation here in Nassau now. If it doesn't go anywhere, I don't think we wasted our breath. We were a little proactive. If it does go someplace, we're already ahead of it and we can have a plan before we need a plan. So that's all I got. Happy to help. There's two other things from the program agency that I didn't mention. Did you want me to wait or? So it's not ready yet. That's why I was remiss in mentioning it. But coming down the pike is a clarification of operating territory for comprehensive ambulance, which is agency code 1186. As the state and everyone else continues to clean up some of the things we've done for decades and decades. Part of that is clearly defining, as was supposed to be done, but by no fault of anybody's, they'll know he's done, clear geographical boundaries. So the case in point here is your operating certificate may in years past have allowed Eastern Nassau County as its operating territory. The question at hand is, what is the geographical boundary of that? So we're waiting on more information and that'll come before the committee here, the council. The good news is it doesn't require a certificate of need. It doesn't require a public hearing. It doesn't require those of us that have been around a while, all of those regulatory and statutory requirements. So once we get that back, it'll come before systems and then come before the REMSCO like everything else. Lastly, we've been in conversations with a number of entities around the county looking to form or reactivate their BLS first response status. So the Metropolitan Transit Authority, the MTA Police, and they're the umbrella, everyone under them, we've worked with to not only square away the reactivation and renewal of their multi-jurisdictional certificate of need or BLS operating authority in this case, which then opens them up for BLS funding, which is currently ongoing for education. Hofstra University has asked the town of Oyster Bay. We're in the process and discussions with them and planning for what that'll look like. The process there is, like everything else, it'll come before the council. We discuss it, we vote on it, and it goes through. The municipalities are a little bit easier, obviously, because they have some statutory authority, but it's not a heavy lift either way. Thanks.
Okay, any questions, Don? I would say once again, and I asked all the agency managers, the reason why we got away from sending it out to, especially the fire service chiefs and other leaders and stuff, is they constantly changing every year, every 2 years. So we designated agency managers, agency coordinators within there, so that we can get the information out. When Don sends us out every Friday afternoon or Saturday, whichever, depending upon the load, the amount of information that's loaded in there. We need to get that out to all of our providers. It's designed to send it to a singular source and then be disseminated to all of the providers that we have out there. As I said, a lot of information stuff in this packet here, a lot of information and a lot of regulatory stuff that's going to affect each and every agency here in the region as well as throughout the state. So please forward that to your agency providers so that they can review it, and if they have any questions, once again, they can get it back to you, which can help us by getting the information and the questions back to us in a timely fashion with that. All right, so, no other questions. Once again, we'll move on to committee reports. As far as the executive council, I've pretty much covered most of the stuff that we discussed in there. We have some education systems, MCI issues that will be coming up under their reports, as well as membership. We have some new members. We have a couple of openings that we're currently working on, once again, to get those filled, as well as some alternates with that. We hope to have, by the May meeting, hopefully have all of the council positions filled, so that once again, we can conduct business without any interruption and stuff in the future. We'll move on to REMAX after Pearson and Dr. Cooper.
Dr. Shielson? All right, thank you. So good afternoon, everybody. First, REMAC wants to announce two new members with the non-voting status, Drs. Mulbauer and Matthew. For St. Francis and St. Joe's were added to the REMAC membership. If any other seats open up, one of these two doctors will be the next one to be moved into a voting position. I'm going to incorporate the airway stuff too, only because Dr. Newbert did ask for an excuse. Up at the CMAC, they gave cumulative data regarding the use of the BLS iGel program throughout the state. In New York State, there were 239 insertions of a BLS iGel. Sadly, though, only 177 of those PCRs made it to the state bridge, and only 114 of those 177 were able to be analyzed. So that just goes to show you how important it is to make sure that the PCRs are complete and uploaded, not stuck somewhere in your eBridge software. So because this hindrance of the data coming up, they can't really analyze to say, to make a final determination. Let's see, it was the 90% of the patients that did receive the BLS iGels, 90% of them expired in the ER, 30% of them got ROSC in the ER. So they're working. You know, it's better than nothing. And we just got to make sure that we document. Nassau County, we had 8 uses that were documented and reported. The RSI committee had also reported out 1 use, 1 RSI, and then 1 iGel. One BLS iGel that was reviewed at the RSI Airway Committee. No issues were found. Airway policies were finalized and added to the Nassau County Policy Manual. Like the chairman said, thank you to everybody for the 100% compliance before the deadline, getting the agency medical director credentialing documentation in. That was fantastic, 2 years in a row. So now we got to go for the hat trick. eBridge continues to develop in progress. There's lots of changes being made, and I don't want to reiterate what was already said. So please keep looking for more changes and upgrades. Dr. Silver from Glencoe Vest, the Airway Committee, if 2 FDNY rescue medics who were trained in RSI and have advanced airway credentials to be made RSI medics, that's going to be forwarded to the RSI committee. New York State CMAC approved version 24 of the collaborative BLS and ALS protocols, and that's to be implemented July 1st. So protocols are going to be changing then. The QAQI committee currently has 3 cases that they're investigating, and there's no reports back yet on any trends or follow-up. And that's all I have for my report.
Do we have any questions for Dr. Cooper?
Just, Mr. Chairman, so at CMAC, REMSCO, and some program agency stuff, there's the largest ePCR vendor currently servicing Nassau's region. You should have received a communication from their CEO this week directly. If not, it should have been circulated, stating that although they're working on meeting the deadline, they have no date to do so yet. So if you as an agency are contracting with a vendor that's not meeting muster, please reevaluate those decisions, because the noose will be tightening. Not a threat, but we got to square this away.
the state's holding the agencies responsible, not the PCR vendor.
And so if you have an EPCR, reach out to your vendors, make sure that they are being compliant with meeting the 3.5 deadline. If not, once again, you may need to consider other options in the future.
And if you're not sure who that is, see me afterwards so I don't get accused of libel and slander again.
You contact our REMSCO coordinator. Okay, we'll move on to communications. Karen Brown. We're gonna have a meeting coming up. Once again, nothing really to report. Disaster planning, Kevin O'Hara.
Right, as I previously reported, previous meeting, MCI plan has gone through its approval phase and all well aware of, and got turned over to training ed. Most of the members are on both committees, not only disaster planning and training and ed. Going through our educational rollout program, I'm not stealing Ed's thunder, but it kind of flows into what I'm saying. We're thinking about, we agreed to give like 10-minute snippets, taking the plan apart in different phases. Because there's certain different people that need to know different parts of the plans, from a down and dirty hands-on part to maybe an executive management or leadership, or somebody's taking a more of a leadership role in an MCI. So more to come on that. We're meeting this Friday again, and we're going to keep rolling to that. Also brought up when we reviewed our MCI plan, our current policy in this county is to have during an MCI medical control with poll the receiving hospitals and see what their status is. By status, we mean, oh, we can handle 4 red patients, 3 red, 2 green, or whatever it might be. Talking to our counterparts or information we receive, and even information from the hospitals when we're telling them that, you know, this is in our plan, this is where we're going to go. Most of the hospitals now in this county are part of New York City-based hospitals, meaning the Catholic system, Northwell, Mount Sinai, etc. And New York City works a little differently, where hospitals are not whole; they just have to be ready. They might be advised at an MCI, and Don, correct me if I'm wrong the way I'm saying it. They sort of have to be, they're advised when there is an MCI to know and to expect you're going to be getting patients, not that I can take 1 red, 2 green. So with that, I think it's going to go back sort of into the committee. We'll discuss it again Friday to see if that's viable here in this county, maybe to do that. And switching over to that, if we could see if that's on par with the hospitals as well as medical control, because we feel that it would maybe alleviate time that they need during one of these larger events to start polling hospitals, and also, time that it would take for the medical command at the scene. Maybe it would take 10, 15 minutes to find out, well, this hospital can take this hospital can take that, rather it would not delay transport time. So more to come on that. We're really following up on this, Friday. Hopefully we'll keep moving a little forward with that.
Any questions on disaster preparedness or you not for the MCI? We want to.
We'll talk.
Okay, yeah.
I'm sorry, I'm just right in front of you. Thank you, I was making it look skinny then. So I got a question with the E-Bridge. Can we put something in the E-Bridge? So if you have an MCI, you can hit a button and it'll alert all the hospitals within the county or within that area that there is an MCI, let's say, transmitted in my district, Seacliff. So it'll go to Glen Cove, let's say Manhasset, St. Francis, Winthrop, be the closest hospitals, so they can start seeing what they can handle, and then they can either contact MedCom, say, and MedCom, listen, Glen Cove, I can take 4 reds, 3 greens, a purple, and a blue, and it'll help. I don't know, something to throw out there that
So I like it. Thank you.
you're welcome.
You're welcome back. So unbeknownst to many in the room, when we bought eBridge, there's a number of buttons hidden that have not yet been implemented. MCI is one of them that does very much what you're talking about. It was hidden initially in our planning and implementation and education, realizing it's going to be a big lift. It's going to be alien. It's going to have, pushback in education and training and phase in and everything else. Once we're over that hump, we'll start unveiling newer processes. So, not to speak for MedCom, the concern is we don't want to put in place, rather than them having to call out to each hospital, every hospital off of eBridge or Facebook or anything else, which I'm sure happens right now in the social media world. Hey, I heard there's a plane down on the South Shore. Are we getting patients? And it's like, it's a drone. It happened 4 hours ago. We know it's on the Wantagh Moms Group. You know, how do we get that right? What is the correct coordination with medical control and what that looks like? Yes, there is the functionality where medical control can blast out messages to hospitals, to agencies, to providers. We haven't gotten there yet, but I guess the initial discussion, and my city people that know more about this than I do, do you like that? Do you not like that? I guess that's the question to the group is, are we wasting our time or is this something we should talk about? Because,
Talking about the polling of the hospitals.
Or
Something maybe
the
phase
tiered-
out of- Yeah,
so New York City REMSCO with their operational aspect through the FDNY Bureau of EMS put in place a tiered system where based on what the hospital tells them, not the other way around, right? This is driven by hospitals, not by anyone else telling them. What is your, let's call it level A, level B, level C. Level A might be every day. We don't need to know about it, but this is what we can take. Level B is, this is where we'd activate our internal processes for surge and all the stuff that the hospitals know more about than I hope to ever know about. And then level C being like Godzilla's attacking, you're getting whoever we bring you. And what would that look like? Is that something that we should explore? If so, what are those numbers for your facility? Is it too dynamic to put down on paper or codify someplace? Those are all the discussions that have yet to be had. So don't look at this, please, as, you know, this being forced on us or anything else. It's the infancy of this. It came from the disaster committee in acknowledgement of what's going on elsewhere in the state. So elsewhere in the state, that's managed. Some of you are probably aware of some upstate operations. So you probably know what a Juvari dashboard is. If you look, our hospital availability dashboard looks suspiciously like the Juvari dashboard. I won't say that's because they liked it and copied it, and I won't say that it's because we liked it and copied it, but plagiarism in my mind is the greatest form of flattery. So if it works, I'm not above using it. So the question is, what would work for us?
Can I just ask that you also bring this report to the REMAC? Yeah, so the other hospital constituents.
So, yes, and that's a good point. So just so you know where those discussions are currently at, we don't have a great mechanism, not to talk for you, but correct me if I'm wrong. We don't have a great mechanism as yet to reach out to every hospital and say, hey, can you come to this meeting? So that's been driven through the state HEPIC, the Health Emergency Preparedness Committee, and the Nassau ESF8, the Emergency Service Function Number 8 OEM function from Nassau Health. So if this is the first you're hearing of it, it's by no fault of anyone's. We're sorry. Welcome to the discussion. So
I think we're looking to get on the ESFA calendar.
Yeah, Dawn and I went
Yeah.
last week and stuff.
they actually brought it up, right? I mean,
Right, they invited us.
the hospitals brought it up and said, why aren't we doing this instead? This is what we do elsewhere. So, you know, there seems to be some interest, like anything else. We don't want to, you know, jump too soon, too fast. What's the right pace? What's the right topic? What's the right implementation?
But this stuff in no way is gonna hinder moving forward to get into that process. We have to keep moving forward.
And the goal is, once again, to try and get this policy out there. It's really gonna be, as we discussed and stuff in the meetings and stuff, is to get the onus on the agency and stuff and the leadership to not only adopt it, but once again, to get their people trained and have them aware of the policy and the procedures and stuff. And hopefully within a timely fashion, because as I said, we have an event coming up here in June that we're not quite sure exactly what our participation is going to be, who's heading this up, what the EMS resources are going to be necessary. And God forbid there is anything, we need to try and roll it out. One of the reasons why we're looking at a virtual meeting is not only to update everybody on all the stuff through the budget and through the legislative processes and the information that's out there, but also once again to try and get the overview and the leadership buy-in to once again at least look at the plan and once again accept the plan As I said, we have many different agencies and many different, communication centers and, hospital agencies, all the various components and stuff in this that have their own, personal, issues that they need to be able to address with the policy. So that's the goal of trying to get it out as soon as possible and have them at least aware of the policy. Any questions for Chairman O'Hara? Okay, we'll move on to education and training. Ed Wolver.
Good afternoon, everybody. Just want to thank everybody in the committees for spending part of their Valentine's Day with me. So we can have a training day meeting. Very romantic for that. Two of the big things that we discussed, the first thing was the sunsetting of the paramedic original practical skills exam. National Registry is doing away with psychomotor exams, and New York State does not have a backup plan per se, one in place to take it up. So a pilot program was passed that as of July 1st of this year, any paramedic original course sponsor program that is COAMPS accredited can follow the COAMPS guidelines and use their portfolio instead of a formalized end of course practical skills exam. So that pilot passed. The Bureau of EMS is working on the format to accept programs into that pilot program, and we will go from there. The tag on the state level is discussing psychomotor exams or practical skills exams, what the future is of those going forward for New York State as a whole. Outside of paramedic original programs, if you don't know, there is no accrediting body for any pre-hospital care provider programs. And historically, New York State has been decades behind the rest of the country in trying to do pre-hospital care. So we are asking that maybe we can be a little bit ahead of the game and try to have lead in doing this, and whether we create portfolios or whatever the tag and the committees decide and the bureaus decide they want to do for the future of EMS education going forward for all of us. So if you're interested, by all means, take part in the tags and meetings and stuff like that. So that's one of the things. The second thing, and Chair Mackey's talked about it, we will talk about it ad nauseum, is the sunsetting of the EMTCC certification. So that was voted on by the medical standards and approved by REMSCO to sunset as of July 1st, 2027. Okay, it's just a little more than 3 years from now. There is, and there has been, a bridge for the past several years to have EMTCCs move up to the paramedic level, covering the gap material that is going on. That is missing in there. So that bridge program runs twice a year right now. There are a decent number of CCs left in the state. However, attendance to these programs has been limited. So we've been talking about this for 2 months now, and attendance for the upcoming April bridge program is still around 20 statewide. So we are trying to get the word out. You are an agency head and you have members. We're sending emails out to every CC provider that we have that we know of. We're asking other agencies to do that because, believe it or not, I actually heard at the last REMSCO meeting from people saying, I don't know there was a bridge program. So I don't know how else we could send the message out. I really am relying on committee members and members of the board and people that are in virtual land to get it out to your agencies and your memberships and people that you know that have these certifications. If they so choose to drop down on that deadline date to an AEMT, then that's fine, that's great. But if they really do want a pathway up to medic, the bridge program is the way to go, or take a paramedic original, it's their choice. Whatever they prefer. We don't want anyone when this happens to turn around and say, I didn't know, and you didn't give me the opportunity. That is our only goal and our only mission, in training ed, to make sure that that does not happen. So, like I said, I will talk about it every chance I get. And then the other thing that comes out of this is, while we are encouraging everybody to please bring forth this news, if there are questions brought back to you, please send them to the appropriate people. The scuttlebutt out there is unbelievable. So if you don't want to talk to myself or anyone else that's involved in the bridge from Northwell, by all means, speak to Don. as your EMS coordinator. I'd be leery even talking to people up in the state, because they may not know the particulars of the program, but reach out, please. There's a lot of misinformation out there. I field emails and phone calls almost on a daily basis. I know Don does the same. They're just trying to give the right information out there. And believe it or not, you know, the wrong information travels a heck of a lot faster than the right information. So we just ask that if you have a question or you don't know, email, phone call, whatever it might be, please reach out to anybody on the committee. Anybody that works for me or works with Don, we will talk to anybody. We will sit down with anybody. You have, you know, a group of medics or CCs that want to upgrade to medic, we will work with a group. We're doing it with groups upstate that they're hopefully coming into the October cohorts, and maybe one or two get to the April, you know, where they want their entire region to work together. We'll do whatever it takes. You know, there's a lot of flexibility with the bridge program. You know, we'll say it's just one of those things that we don't want anybody to turn around and say, you didn't give us the opportunity. So that's all I'm gonna say on that. For this meeting, I'll probably bring it up at every single meeting going forward, but it's just one of those things that we want to make sure we get the right information out there to the people. Be sending out emails the next couple of days for the next training and ed meeting, set up a date. That's all.
Just to that, just to be clear, because again, I know there's different rumors out there. So since its impetus, the bridge program, as far as tuition goes, is essentially free. What that means is, so current New York State reimbursement for a paramedic original and currently the bridge program is set at $1,500. That pays in full the tuition to the bridge program. The intent was that neither Northwell nor any of the partner core sponsors, such as Fire Police Academy, puts in, or we've agreed not to put in for that money. That is open to the agency, who is supposed to then take it and give it back to the member. You can work out whatever that looks like on your end, whether it's a time frame, work release, hours on the clock or in a car, or what, that's up to you. Partnering with that is if the agency then agrees to supplement the books, which is another cost, you know, the cost as intended to the member for years now was supposed to be cost neutral. Currently, due to dwindling numbers and you know, the need to keep the lights on, the bridge program was, the fee increased. The Bureau and State Education and Education and Training, along with State EMS, REMSCO Finance, is in the process of raising the paramedic original to the $2,200 to continue to offset the cost of the bridge program. So if that's news to you, I'm sorry that word didn't get out through your agency. That's common knowledge to anyone who's been paying attention, but if anything else, if you have questions or not sure why that's not occurring, please don't hesitate to reach out. We're all in this to get it done because it needs to be done and it needs to be done right. Nobody should be left behind. There's mechanisms to assure that. Thank you.
Legal and Governmental Affairs, Dr. Booten is not here today. We're currently working with the medical center and stuff. Dr. Booten, as you know, once again, has left UMC, and we're currently waiting to once again see how that seat is going to be filled in the future and stuff. With that, as I said, currently I've asked Frank DeVovis, who's currently on the committee, a senior member of the council, to convene the committee, look at the bylaws, which is part of their purview, so to speak, as far as legal and governmental affairs, to look at the bylaws through September and make any recommendations or any changes and stuff with that. And once again, we'll allow them to make any changes as necessary with that, and we'll update the committee probably by the next meeting and stuff on how that will work. Public education and the REMSCO awards. Chief Chester is unable to attend today. Had requested an excusal. Things are moving along once again with the public education. We're hopeful that through the program agency, through the state, I know there's money and stuff that they're looking to push out for recruitment and retention. We're hopeful that we're going to get some money through the regional council to be able to put into that. Also, as we've stabilized the program agency and been able to get our feet on firm ground, be able to manage the day-to-day operations for the most part. We're also looking to work with the Facebook page and stuff that's kind of been lax and not been on the forefront of our social media platform. And I've had some committee members and alternates and stuff that have approached me that are looking to, once again, be able to update the Facebook page for the council and to get the information and stuff that's necessary, such as the bridge program and availabilities, jobs, those type of things up on there, as well as the going-ons that are occurring on a daily basis here in the county with that. So I'm gonna try and work with them and Chief Chester and stuff and try and get them integrated. Most of them are technologically savvy, much greater than I am, and once again, can be able to enhance our operations out to the media and out to the public and stuff on what we do on a daily basis. EMS systems, Chris Aaron.
Good afternoon. When this council last met, we had approved a request by the Lakeview Fire District to change their order in the response matrix, just as a follow-up to close the loop on that. That had been approved by the council. It went to Nassau County. Nassau County reviewed and approved it. That went to Communications Bureau for CAD programming, and that's been in effect now for quite a while, since the second half of January. Since that time, the EMS Systems Committee had met. We addressed a few items. We have two agencies in the region that are transferring their ambulance operating certificate from their fire department to their associated fire district, namely the Hicksville Fire Department, the Hicksville Fire District, and the Wantagh Fire Department to the Wantagh Fire District. It's quite an extensive process, quite a bit of paperwork and sign off and oversight required on multiple levels. Part of that is an examination by New York State of the applicants for making sure that everything is in order with their papers and their organization and the individuals associated with that. So this council had received two items of communication from New York State. One for each of those aforementioned agencies, and essentially what it is that they passed the test, everything looks good, and we can now move on to address it at the regional council level. So with that in mind, we will be passing that on as an item for voting. By our bylaws, we need to conduct a roll call vote on each of those items individually, and we will be doing that when we come to new business later on in the meeting. The other two items that we examined were two matrix change requests. And I just want to start off by saying that EMS Systems Committee looks at and examines requests for changes in the ambulance 911 matrix. So that is to say, we look at the EMS system as a whole. We try to assist agencies that have needs and examine how we can basically get the patient care to the patient, get the patient to the hospital, get the ambulance to the hospital, as efficient as that may be, taking all sorts of factors into consideration. So we do not make determinations regarding the fire department's internal dispatch procedures. This solely has to do with the 911 side of the page. Okay? So the first item that we looked at was a request by the New Hyde Park Fire District to upgrade their response. They're currently number 4 in the response matrix, and they wish to move up to the 3rd position. They gave us a lot of additional statistics and information, and essentially what happened was they have a very long-standing paid district ALS provider program, 24/7, to supplement their volunteer response. They've now added a BLS district employee program on top of that to essentially guarantee that there will be a transporting ambulance going out with their medic fly car and or their rescue company volunteers. So that is all the stats look great. They certainly are well positioned to move up in the matrix, and we're forwarding that to the council as a second motion with the recommendation for approval. The second item of business regarding matrix changes was one that took up the vast majority of our discussion. And it is a request from the Bayville Fire Company to be dual response with Nassau police ambulances, regardless of when the assignment is and where they are in the matrix. They happen to be primary in the matrix at this point. So that would mean that they would be alerted. Second is a local ambulance in their district. And then after that is an ambulance coming from much further away. We had a lot of discussion in the committee. We had a lot of discussion. We had a couple of dialogues with their leadership, and they have some very valid concerns. The committee and the council, and also to some extent previously, the Office of the Chief Fire Marshal has put out communications, and some of this we had discussed here previously, came out during the pandemic, regarding the unilateral issuance of dual response. And how is that beneficial? And while dual response is always beneficial to the person getting the dual response, what also unfortunately happens is that it does have implications system-wide in other areas of the county where an ambulance may be pulled and needed elsewhere, whereas there is actually an ambulance that is responding. That being said, a lot of the discussion revolved around, as Bayville had stated, they have extremely unique geography. Not familiar with it. Very unique geography, creates some really resource availability challenges. Probably one of the most unique of maybe a couple in our entire region. So, we didn't want to, we're very cognizant of that, and we want to support them. We also, they only have a small number of ALS providers. Their EMTs are trained to request ALS, and we understand that. We wanted to make sure that, they have a hospital that's about 5 miles away, that they're not in a position of looking for an ALS intercept. They said, no, their leadership is very well versed in that. They don't train that way, and that's great. There's concern about what happens if they need an ambulance and their ambulance might not be getting out, and how do we address that? So what we came up with was they're going to stay primary, but we're going to give them what CB and Firecom calls the tiered response, which is essentially any assignment that sounds like a high priority assignment: an arrest, difficulty breathing, stroke, overdose, altered mental status, seizure, things of that nature. Immediately, right off the bat, you're getting a police ambulance going with you. Lacking that, it's you're going to have an ambulance coming, and if basically the fire department gets out and it's a high priority thing, and you don't see a police ambulance there, you have to start transporting. That, of course, doesn't really have a bearing on the fire services dispatch policies, and they're free to examine how they need to request additional resources from any agency, be it mutual aid agreement or police ambulance. So that's something that they're cognizant of. So there's a lot of discussion back and forth, and we feel that this is not going to be a change in the matrix as far as they're going to remain primary. There is a secondary police ambulance right there that's going to be going with them. We also recommended that the fire department examines those re-alert parameters and narrow the time frame by which there would be a re-alert and flipping it over to a police ambulance, so that we can identify those gaps early on and get another ambulance dispatched.
Any other questions with the systems, Chairman Aaron? All right, so they'll come back up under new business. I would add to that, as Chris said, we're here to look and make sure that we're getting resources to the areas that we need. And we're not looking to, once again, take away from anybody that seriously needs it, but we need to, once again, make sure that we're not duplicating services and stuff throughout the county. So if your agency is struggling, it does take time to make matrix changes and for us to discuss it, and once again, make sure we're doing the right thing for everybody. So please send us an email if you're struggling, if you're having issues with staffing, if you're having a problem. email the council so we're aware of it. And once again, we can look at it before it becomes a major crisis, because as I said, it does take time for us to make these changes and to be able to get things through the systems committee as well as through the council. All right. Membership, Robin Trot.
Yeah, thank you. The Emergency Nurses Association has appointed Michael Schwartz to the REMSCO council seat that was vacated by Linda Yorkin. Michael is an administrative nursing supervisor at Mercy Medical Center and a paramedic at the Nassau County Police Department. The ENA leadership has also appointed Matthew O'Connor as the alternate. Matthew is an RN at Mercy Medical Center at the Emergency Department, is a paramedic with the Nassau County Police Department and a certified firefighter. He's also Deputy Chief Instructor at the Nassau County Fire Service Academy. We've gotten all the documentation for each of these two appointments to the council. They've been received and all is well with that. Council still needs to fill the seat left vacant by the Regional Trauma Advisory Committee and Glazer. We discussed that, and the membership committee is waiting on the status of Dr. Anthony with his departure from the committee. Also, remember that if you can't make a council meeting, please notify REMSCO that you need to be excused.
Okay, thank you very much. That's what we brought up under the business as well. And once again, I know Michael's here. Congratulations. All right. Move on to subcommittees. I think we've covered pretty much everything. The RSI, BLS, IGEL was covered by Dr. Kugler and Dr. Newbert's absence. Anything else under eBridge Communications, Doctor, you wanted to bring up or?
No.
You're good. Okay. And once again, the REMSCO REMAC EMS tag, as we said, has been on hold while we're waiting the county committee release of the draft. So we did send a letter of support through the fire commission to once again try and get that draft back onto the table to look at the recommendations, see how we can improve, and once again be able to sustain our EMS operations here in the county. So that is forthcoming. We're hopeful that we're going to get some information very soon on the status of that. I know the chair of the committee is supposed to be having a meeting with county leadership to discuss how we go forward and how we get that information out for review like that. Does anybody else have anything else under committees that we may have omitted? All right, we'll move on to unfinished business. Anybody have anything under unfinished business this time? Yeah. I will move on to new business. Once again, I left for approval of the county council treasurer's report from January through today.
Make a motion.
A motion. A second. Any questions? All in favor? Excellent order. Rescheduling of the June 12th REMSCO meeting. As we said, we have the cricket tournament coming up in the beginning of June. Once again, we're not sure what the resources and the availability of a lot of people, especially with the council and stuff, might be, how our involvement and stuff will be utilized during that period. So I would make a recommendation once again that we move that June meeting possibly to June 19th, the week after Wednesday, 2024.
Mr. Chairman, I'll make a motion. We go with your recommendation, moving it to June 19th.
June 19th. All right, second. Okay, all in favor? Aye. Okay. All right. Chris, you want to bring up the changes? That's a better holiday.
Yeah, I mean,
It's an, oh, it's an 19th?
Yeah.
Juneteenth. Forgot about that. How about the 18th, with a Tuesday?
You want to give people some breathing room and bump it to the next Wednesday?
The next Wednesday, the
26.
People may need a day off after,
26th is fine by me.
I'm just saying.
26th.
my fear
I make
is
my motion.
Amend the motion.
everyone's gonna be EMS'd out.
Okay. All right, so like a June 26th. Second, all in favor? Opposed?
That's residents.
My calendar. All right, new business.
Seconded motion on the floor for the approval of the New Hyde Park Fire District.
Okay. So we have a seconded motion coming forth for New Hyde Park Fire Department to move up on the matrix, from the fourth position to the third position. Second? Okay. All right, so. Okay. Well, all in favor?
No, that's.
Aye.
Anybody opposed? Okay, so what?
The other one is not really major
Right.
change. We'll have an ongoing discussion, on the dispatch side. And then we have the two, roll call votes.
Just for the Bayville one, was, what do we need procedurally for CBO for Firecom? Is it something from us or from them? I want to make sure we cover the bases to get it done.
No, the chief has to let us know what he wants done with his response. So he has to send us a letter, that's all. You know, addressing the change that he wants the stroke, cardiac arrest.
I thought there was a pilot program that they were using Babel and another fire department, if I remember correctly, when I was chairman of the battalion. Certain call types automatically got.
This
That's
this actually started with Floral Park and it's been used successfully with several of.
Babel had it too.
East Norwich had it, so.
That's what it was. Yeah, I knew it was somebody else.
But it's an opt-in and I'm just trying to see,
Yeah, they
we
just
don't
have to-
opt them in, they need to opt in.
Yes, they need to let us know that that's how they want that handled.
So then the big question, are you making that phone call or do you want me to?
We'll talk about that.
I think I know what that means, but yes.
We'll settle those. With that, hold that thought. First of all, I want to introduce Chief Michael Utaro. The Chief Fire Marshal asked to come down and just to talk to us briefly and stuff. Big proponent once again, he took us on when we were rudderless, without a program agency. And has been there to once again give us the administrative assistance with that. So I'd like to introduce Chief Michael Utaro. He's also the chairman of the committee that we discussed earlier on.
Okay, I'm not gonna take up too much of your time because I got a couple of things they're gonna square away, but I just want to give you a couple updates. Chuck's been asking me for some time now. I didn't have a lot of updates to give him, but I have a few. So just briefly, the big thing is trust me, I promise you all the pages. This is just a whole bunch of other crap I have in here, notes and meeting minutes. This is that EMS Coordinated Response Committee report. Working with County Executive's Office and PD, going through some different things, clarifying a couple of things. The county is always, obviously wants to protect its liabilities, which is completely understandable. But we seem to have finally come to a point that the reviews are done. I have one more discussion with Tatum Fox, who's our public safety deputy county exec, and we're gonna go to print and it'll be sent to obviously all the partner agencies first, such as REMSCO, the Fire Commission, just to review. At some point, there will be, obviously, like every report is, there was a previous report with Pat Ryer, right? He was the lead with the last report. That'll become a public document, and obviously then foilable, but that's why we wanted to make sure. In it, really, a lot of this is all the past reports going back into the 70s or 80s. So if you want to take a walk down history lane, it's all in there for you. The hope is then what we've been trying to do, and I know what the committee worked very hard to do in a lot of active discussions, is to identify all these great conversations we've had over these years and see that we've gotten a little far, but we really haven't gotten to where we need to be. Some things have been implemented, some good things have come out of it. We're still trying to, we had the Crew Force app that we brought on with the Tyler Mobile. There was definitely some hiccups and trips coming out of the gate on that. We've worked them through. Tyler now is able to put it into not just Apple products, but MDTs, Windows-based products. I'm not a tech guy, but basically They just finished working with Manhasset Lakeville. They're right now currently working with East Meadow, and they had tremendous success. Manhasset Lakeville took the better part of about 2 to 3 months because they had lots of tech problems. They went to East Meadow, and within one day, they had all their units programmed and they were all showing up. The hope is that once we get that going, program is only as good as the participants. If you went on Flight Radar, if you've ever checked that Flight Radar app out, if you went on that and all you saw was Delta Airlines planes, it really is useless. So it's the more partner agencies come on. It's not meant to punish, it's not meant to track, it doesn't check people's speed, doesn't care where they're sitting or hiding or whatever you want to call it. It just cares about who's available, who's assigned to a call. So if a call comes in and you see 3 or 4 different agencies converging on the same call, perhaps and hopefully somebody can call somebody off and make sure that those assets are available for something else. They'll also try to encourage the volunteer fire service and volunteer ambulances to come on duty as duty hours or duty time or standby crews or whatever it may be. I think we can all agree if you've ever tried to get anywhere, it used to just be rush hour. Now it seems to be almost all the time trying to get from your home to your firehouse to staff an ambulance and get it out the door is increasingly difficult. For the younger people, it gives them predictability of when they're going to have to sit in house and do their duty hours. And for some of the senior members who get tied up at work, like myself, I do duty hours in my department. It's a lot more predictable and easy to know what night I may go down there versus when the pager goes off, I'm always busy doing something. So the hope is it'll build. We definitely, like I said, when we had the meeting with all the active chiefs of Nassau's fire departments, one of the guys brought it up, and to be honest with you, I was embarrassed because we didn't have an answer for him. And it took a while to get there. Nassau IT has been great in getting all these little bugs resolved. But there's still a lot of nonsense and, commentary and rumors that are going on out there. I know everyone's surprised, rumors of the volunteer fire and EMS service. But, that's one of the things that keeps going on out there. And I spent a lot of time knocking down rumors, trying to give the right information. So it is live. A lot of departments, looking at Jim, I know his department's on board with it. And as we get departments on board, we can start working on policies about how we're going to utilize that, and how we're going to utilize the device. I sign on, I sometimes forget to sign off, so people get to see what I do on the weekend, because I'm here, there, or everywhere, on a soccer field, whatever it may be. That's not the reason behind it. I told the chiefs didn't want to get tracked. I told the chiefs politely, we really don't need to know where you're at. What we do need to know is where your ambulance is, your trucks, your engines, your rescues. The next, which that'll tie into the next thing, you probably heard, I've heard it to death, the cricket, the T20 World Cup of Cricket is coming to Nassau County the first 2 weeks of June, basically starting around the 1st, 2nd of June is the first matches. They'll be doing practice matches before that. 2 weeks, they're having the trophies coming here and they're making a big bunch of fanfare about that. So that's going to take off and the ball will get rolling. The stadium is getting built. It's a 34,000 seat temporary stadium in Eisenhower Park behind the aquatic center. If you've gone through there, it's well underway in construction. Construction is looking to be completed by the end of this month to early April. They're going to start they're growing the grass in Florida and they're shipping it up here. I don't know a lot about cricket, so I'm not going to even try to explain how the game works. I tried watching these, but neither here nor there. It's a huge spectacle. It's the second most popular sport in the world. There is a premier match coming here on the 9th of June, which is India versus Pakistan. They expect a sellout, plus they expect watch parties all over the county, especially in communities of the different nationalities that are participating. The leadership or the prime ministers and higher ups and princes and I don't know what else their titles are from different countries are coming here. The police department has its hands full right now trying to cover all the bases of that. There'll be helicopters landing. There'll be a lot of movement of people. And obviously with that comes fire, EMS, hazmat, decon, and police, like I said, who have their hands full. So working on all those details, the event coordinator has to provide, as the state requires, a Part 18 report. They're gonna have to file, I think I got Part 18 correct. They're gonna be filing their EMS plan for how they're gonna deal with everything within what they call the red zone, which is inside the secure fenced-in area. They usually have doctors, they have first aid tents, they have medical tents. That's separate from the players and the VIPs and all that, but that all has to get set up. That plan has to be filed with the state. I don't know where they're at because they haven't even given us the construction plans yet. The building's going up. So that's gonna come in play. It also comes in, they will have to have, according to the plan and the participants, a certain amount of ambulances allotted from what they're looking at right now as a private vendor that they're gonna hire, like they do for the Coliseum, the UBS Arena, and things of that nature. Outside of there is where our concern is gonna be, and working EMS wise is gonna be a shared effort as we usually do. From what the understanding is, from what we've been told, we will be probably talking to East Meadow, who we've already had meetings with. They'll probably be asking for ambulances to be staffed so that they can just dedicate ambulances to back up anything that may happen. There's gonna be multiple sites. They have a parking area by the Coliseum that they're talking about using, and this is all fluid and it's changed about 4 or 5 different times already. But expect it to be a very busy 2-week period, especially on the highlighted games. They'll be having practice matches. We've been told that they may be practicing in Kenyon Park. I guess the police definitely have their hands a lot more full, trying to cover all the bases of security, especially all the stuff going on in the heightened state of the world with Gaza and everything else that people look to protest. So that being said, that's being worked on. As I get information, I'll share it with you. Right now, the information is limited, so I'll get that out to you as quickly as soon as we have it. What else do we have? Crew force, and crew force, like I said, I just went into briefly. If anybody has any other questions, I know Mark could probably answer some of those. If you have anything, you can direct it to me. We have a decent amount of buy-in from departments, but I think a lot of it is just the lack of solid procedures on how we want to do this. The one thing I will tell you is fire, which I've already told with East Meadow about. That's one of the reasons why they had it loaded into their systems. Any mutual aid or any participating emergency response agency outside of the police department, law enforcement officers, cops, state troopers, or any other of their partners they bring in, we're going to track them through the Crew Force app. So we know where the closest vehicles are, we know who's where, we know who's assigned. We've already used it at working structure fires where we map out to the street corner where different apparatus is. It's identified very simply by its unit number and what type. So it makes it a little bit easier. I think it's been a great asset. We sent it out for hazmat, for our investigators, for our drone team, and several other departments have hopped on board. But we are going to make it a useful part of this. It's kind of twofold because number one, it's going to give us good organizational abilities and be able to see and share with all the partners that are on the system where the assets are at, where they're staged, who's available, who's not available. And the good thing about it is it goes to every person's phone or tablet or any other device that's logged into the system. And it's secure, obviously. The other part of it is it's a nice way of getting people introduced to it, using it in an operational manner with a plan. So hopefully those who utilize it, it's almost kind of like they get to try new food, and hopefully they'll like the food, and they'll stay with the food, and we'll keep building on the system and make it better. So the last thing, I know I went on one of these seminars, which you guys have probably talked to at great length about some of the things coming through. One of the big things that affects us is emergency medical dispatch, which it looks like the state is going to, and the state is going to require us to do. Firecom did do and still does emergency medical dispatch, where between vendors, we had a vendor. That vendor wasn't exactly the most easiest one to deal with. So we're going to be working on alternatives, but obviously that also applies to secondary dispatch agencies. There's 23 non-Firecom fire dispatching agencies in the county. There's also CB. So we're going to be working on all that and trying to come up with a cohesive plan of how we're going to deal with emergency medical dispatch, which is going to become a state necessity. And then as far as calls, we started about 2 years ago in the fire service. We had a lot of what we call do not respond locations. I don't know if anyone in the room that has a department that had a do not respond location, whether it was because of an emotionally disturbed person, danger to somebody because they were threatened, or in some cases, people said it was that, and it was really because it was a frequent flyer. We had found out that the volunteer fire service wasn't assigned to any MTA or railroad property. So if you were next to the railroad property and somebody was having a heart attack, you wouldn't have even been considered to be called to that property. It's a huge problem. We erased all that. It was a couple of hundred, if not maybe 1,000 of those locations that you guys had to go one by one and pull them out of the system and restore them. We whittled it down to just a few last year, and this year we're at 0. So all departments that get assigned a call are responding to that call. I know there's some other stuff that goes on behind the scenes with it getting kicked back into the system. But that the calls that are assigned from Firecom go to the secondary dispatch agency to put out. And they're supposed to be answering those alarms, so there'd be no ignoring. I know there's something before you about a railroad station in a certain area. That should fall into play too. We're all taught, including myself, an EMT refresher, scene is safe. If you're going to a scene you feel is unsafe, we're all taught in our training to contact police department to ensure that the scene is safe before you roll in. And that's never changed, at least in 20-something plus of 30 years that I've been in EMT. And don't call for me for help because I'm definitely by my own admission, probably not the greatest EMT. But that being said, it's a work in progress. It's been a lot of stuff. There's days I feel like we've made no progress, and there's other days you look behind you and say we've made a lot of progress. But a lot of people that are in the right mindset that want to keep the ball rolling down the field in the right direction have been a huge help in making that happen. We don't always agree to everything. We don't always agree to how we do things, but it's starting to come together. There are a lot of fire departments. There's 2 or 3 that I know of right now that are looking to request these services of either Northwell or NYU Langone. We've been actively talking to both of those agencies about crew force as well and getting their ambulances. Talked to Alan from Northwell as far as how do we interact and how do our systems interact, so we know where your closer ambulance may be. NYU operates a different way as far as how they have their ambulances staged. They're assigned to different departments like Floral Park and Garden City. But the same thing will apply. It's meant to capture all of our first response agencies so that we know it's a step in one direction. It's not getting us to our final destination, but at least it's going to be able to share that real-time data. And the end result is, I think we can all agree, if we had a family member, a friend, or anybody else that called for an ambulance, I don't think we really care what's written on the side of it. I've explained to several fire departments that have had interactions with New York State. I talked to Brian Greenfield from the state about it, about them, their names on the side of the ambulances has caused a lot of dismay and confusion for some of the fire departments. What do I have to do? And he's given some pretty good information, and we're hoping to bring him to a fire commission meeting to better explain to some of the departments that still have questions. But I think he's done a hell of a job of getting the information out there. He held a session, I understand, at the Coliseum during the Buff Show, to tell them it's not as bad as you think. You don't have to get out with a spray can and, gloss over your name on the side. You can put operated by. There's several different variations that make life a little bit simpler. So also, we lost Town of Hempstead EMS, which is it's unfortunate, especially as we go into cricket, which means the calls for the volunteer fire service and EAB are going to go up because a lot of things were kind of handled on those beaches by Town of Hempstead EMS. I hope it gets resurrected one of these days. I don't know, really don't exactly know all the parameters behind why it went away. It did perform a definite helpful service, and it's another leg in the table that got yanked out, and this time it's really not. There's never a good time for it, but especially now. That being said, I don't know if I'm missing anything. Covered most stuff. So if you guys have any questions, but I didn't want to come to you. I know Chuck's been asking for several months to stop by. I didn't want to just come and have nothing to offer. Hopefully by your next meeting, you'll have a copy of this that'll go to Chuck and the executive board, and he'll be able to share it with all you guys as participants. There's no secrets in there. I think there's a lot of good information. Some of it is definitely, I think, honest discussions that happened in there from all the partners that were involved in that committee. There were some heated conversations for those of you that sat in those meetings, which, was probably a positive. You got to get it out. And I'm hoping that it won't become yet another appendix of a future report. Hopefully, some of the things will be addressed. And because unfortunately, for those of you that are sharp-eyed, you can read this report and read a report from 20 years ago, and you'll see some things that are still listed. And that's a shame, because we need to get to a better place. But lately, in the past 10 years, being part of the fire service for 36 years now, it's troubling to see how many departments are having difficulties. Even the big mighty ones that people thought would never have a difficulty in the volunteer fire service are having trouble getting trucks out, engines out, and ambulances. And the times at the hospitals, there's a myriad of complaints about why volunteerism is down. State just actually put a report out that makes being a volunteer even harder, because they are proposing a state law to increase every firefighter has to submit his training documents every year. So we're gonna definitely work to fight that because it kind of goes in the wrong direction. But I won't take any more time.
Okay, thank you very much. Appreciate you coming in.
Okay, thank you.
Thanks again for all your help. Okay, we'll continue on with new business. We'll continue with the transfer of authorities.
Yeah, you have to have a roll call vote.
Yeah.
I got it. All right. Harry, Which one?
We'll do Wantagh first.
Wantagh, yes.
Kindergarten. Kindergarten.
Seated or alternates?
Seated, if they're not, just seated, if there's no seat as the alternate.
Okay, yeah. Good. Kindergarten.
Yes.
Jamian,
Yes.
Mackey,
Yes.
Rigney,
Yes.
Trot,
Yes.
Metropolis. Wilkins,
Yes.
Devaney,
Yes.
Hudson,
Yes.
Waldron,
Yes.
Bodnar,
Yes.
Tenio.
Yes.
Chang,
Yes.
Shearson.
Yeah.
Calendar. Oh, no, alternate, I'm sorry, not alternate. Myself, yes. O'Hara.
Yes.
That passes. Okay, next is, Hicksville. Harry,
Yes.
Kindergarten,
Yes.
Jamian,
Yes.
Mackey,
Yes.
Rigney,
Yes.
Trot.
Yeah.
Metropolis.
Yeah.
Wilkins,
Yes.
Devaney,
Yes.
Hudson,
Yes.
Waldron,
Yes.
Bodnar,
Yes.
Tenio,
Yes.
Chang,
Yes.
Shearson.
Yes.
Self is yes, O'Hara.
Yes.
All yeses.
All right, all motions passed.
Motion passed.
Passes. Anything else under new business? Need to bring up, membership for the, Emergency Nurses Association, we need to
I'm sorry.
for the Emergency Nurses Association, the council member and alternate and stuff.
Correct.
Bring that up.
Michael Schwartz, who is taking the seat vacated by Linda Youngkin. And his alternate is Matthew O'Connor.
Okay, so we have a motion to once again seat Councilmember Michael Schwartz and the alternate Matthew O'Connor.
Matthew O'Connor.
Just procedurally,
One at a time.
what's that?
One at a time.
Well, the bylaws, correct me if I'm wrong, state that the seated member appoints the alternate, not the council. Is that correct? Yes. So I mean, between you two gentlemen, who wants the alternate? I guess so it's the constituency.
So it would be me as the seated, Matthew is the alternate.
That was the way it came down. Yeah.
Okay, just to be clear.
Yeah.
All right, cool. Thank you.
All right. So, second on that? Okay. All in favor?
Aye.
So, okay, welcome, Michael.
Thank you.
Look forward to working with you.
What you wish for.
Anything else on the new business? Anything else on the new business?
Can I outside of it? Hey, Dr. Nancy, I just, I don't know if many people were on the call today on coaching champions for pediatric readiness. If anybody was on, there was a national pediatric readiness survey that came out prior to COVID. And they've been trying to get this back up and running. Most hospitals have answered the call. Today, they brought up just in the call, EMS and pre-hospital related care. There's a survey. I'm gonna send out an email probably to a couple of people here to send out. It's just really, they have some basic great training videos, things like that that can be used for EMS pre-hospital for pediatric readiness. And there's a lot of talk really about hospitals that are not pediatric centers, just being ready for emergency. So I'll send that out a little bit later.
really a survey just to get, at least New York, this is a national related survey, but they don't have much participation pre-hospital, so I think it'd be great to have some agencies just actually, enter in there. They have some great videos for coaching, champions in that for EMS agencies also, and then training like that tools. A couple of different ones even that I got, just even for training in hospital, for physicians, for nursing staff and things like that, to make the easiest mannequin available for training for pediatrics also.
Like I said, if you could get that out, just email it to Dawn and stuff, we can get it out to the rest of the council members. And hopefully maybe get it onto our Facebook page and social media and stuff like that. So thank you very much, Doc. Anything else for the, for good of the council? I'll ask for a motion to adjourn. Seeing the next meeting is scheduled for May 1st, 2 p.m. Location to be determined. The next REMAC meeting will be April 3rd, 2024, here at the Public Safety Center.
Motion to adjourn?
Thank you. Thank you all for coming. Thank you all for participating.
Thank you all.
Yeah.